Since 2005, 9 rural hospitals in Georgia have closed and another 20 are at risk. That is according to the Center for Healthcare Quality and Payment Reform. As a governor, would you prioritize keeping all rural hospitals open, or would you accept some closures in order to reduce costs and invest in alternatives like telemedicine and regional care centers?
Mr. Thurmond, the first response is to you.
Thank you so much. I was born and raised in rural Georgia on a dead-end dirt road. I know what it's like to grow up in rural Georgia and feel like the people in the big city have overlooked or had less concern for my family and the issues that we would face. I will expand Medicaid during the first year of my administration. We will expand it from the inside out, not the outside in. The governor controls 90% of the budget. And by the way, the Republicans, over the last 10 years, those current and former Republicans prevented the expansion of Medicaid. We have left $20 billion on the table in Washington because we refused to expand Medicaid. I was in Charlton County standing by an abandoned hospital just a few weeks ago. It is disgraceful, and as your next governor, I promise you this, you will not have to not have access to health care simply because you're born in rural Georgia. Rural Georgia will have a seat at the table in the Thurmond administration.
Thank you, Mr. Thurmond. Mr. Duncan, the floor is yours.
So I've been working on this issue since 2015. I was the author of the Rural Hospital Tax Credit that now, looking back, has raised over $500 million for 54 rural hospitals and allowed them the creativeness to try to solve some of those problems. But make no mistake about it, Donald Trump and his MAGA followers and every Republican candidate that's in this governor's race is attacking our rural hospitals straight on and making it impossible for them to stay open in their communities or to deliver the services that their communities expect. Look, I've been behind enemy lines on this issue. I try to look at opportunities to improve our health care system in Georgia as a former Republican, and you can't do it without expanding Medicaid. As governor, I will lead the charge. I know the members in the General Assembly on both sides of the aisle that are supportive of this effort will pass the legislation, will fund it, and will draw down those federal dollars. But there's also opportunities to create investments in technology to drive access deeper into the rural communities so that we can start to tackle infant and maternal mortality rates at a substantial rate and to deliver services in those rural communities and allow them to economically develop.
Thank you, Mr. Duncan. Ms. Bottoms.
The state of health care in this state is shameful. We are the home to the CDC, yet we do have 9 rural hospitals that have already closed. We have 300,000 people who aren't insured in this state because of the refusal to expand Medicaid. We left $700 million on the table because of the refusal to expand Medicaid. Reopening hospitals in our rural communities has to be a priority. We also have to invest heavily in making sure that we have public health clinics, mobile health clinics, that we are giving incentives to health care providers to go to rural communities and provide much needed health care. In some communities, you could be even an hour away. Some people ask, why does it matter to me if I don't have Medicaid or don't live in a rural community? Well, if you've ever passed through one, it should matter to you. It literally is a matter of life and death.